Welcome back to Talking Ketamine. This is episode 24.
Good to be here.
So today we're digging into something really um, quite remarkable about ketamine, just how incredibly versatile it is.
Yeah, it really is. We're talking about one single molecule that seems to help across a surprisingly wide range of conditions.
And understanding how the dosing works,
Yeah,
that seems to be the absolute key to unlocking its potential for individuals.
exactly. It's almost like discovering all the different tools you have in just one kit. And for this discussion, we're really leaning on a comprehensive review that came out in 2025.
Ah, okay.
It's titled Optimizing Ketamine Dosing Strategies Across Diverse Clinical Applications. It was published in the Annals of Medicine and Surgery, and it does a great job laying out how these different doses and different methods are used very specifically to target, different outcomes.
Got it. So think of it like finding the right hat for the right occasion and making sure it fits you personally.
That's a good way to put it. Tailoring the fit makes all the difference.
Okay, so let's unpack these different roles then. Because ketamine, it has quite a history, doesn't it? For years, decades really, it was mostly known just as an anesthetic, right? And a pain reliever.
Precisely. Its first big use was in general anesthesia and for managing pain, particularly in surgical settings or emergencies. It was and still is valuable because it often keeps vital signs stable.
But the really exciting part, the more recent development, is its role in psychiatric conditions, especially things like severe depression, the kind that doesn't respond well to other treatments, TRD.
Right. Treatment-resistant depression and also acute suicidality. That's where it's really been, groundbreaking.
And it works very differently from, say, traditional antidepressants. The source mentions it affecting NMDA receptors, kind of like a reset for disrupted brain pathways.
That's spot on. It is a fundamentally different approach. Your typical SSRIs, they often work more gradually, kind of adjusting serotonin levels over weeks.
They could take a while.
Ketamine, though, it targets the glutamate system, specifically the NMDA receptor. So instead of that slow adjustment, think of it more like hitting a quick reset button for some crucial brain communication networks.
A reset button.
Which allows for these really rapid and quite robust antidepressant effects, often within hours, not weeks.
Hours. Wow. That speed, you can see how that would be absolutely life-changing, potentially life-saving in really acute situations.
No question.
So focusing on depression then, the paper talks about finding a specific sweet spot for the dose. For TRD, it mentions studies using around 0.5 milligrams per kilogram, intravenously, usually over about 40 minutes.
Yes, that's a commonly cited dose for achieving those rapid antidepressant effects. But what's really interesting is this idea of an inverted U-shaped dose-response curve.
Inverted U, what does that mean exactly?
Well, it means that moderate doses, these sort of subanesthetic doses, not enough to put you fully under. They're often more effective than either very low doses or very high doses.
Huh. So it's not just more is better.
Not at all. Actually, the review points out that a dose significantly lower than that 0.5 millikilogram mark, like maybe 0.2 millikilogram, is often found to be less beneficial for serious depression.
Okay, that's counterintuitive maybe, but really important for getting the treatment right.
It really highlights how precise the dosing needs to be. You're aiming for that optimal therapeutic window.
And this applies to different forms of ketamine. The review mentions both racemic ketamine, that's the mix, right?
Yeah.
And esketamine, the esketamine form.
That's right. Both racemic ketamine and the purified esketamine have shown they can improve depression severity. Having both gives clinicians options.
And going back to that speed you mentioned, the rapid effect in suicidal crises, the paper says relief can be seen within hours, like 4 hours, 24 hours post-infusion.
It's quite striking. Significant improvements are often noted that quickly. In an emergency, that kind of immediate relief and shift in perspective can be absolutely critical.
But then there's the question of how long the effects last. I think we actually touched on this challenge of duration way back in episode 9, extending the benefits of ketamine treatment.
Yeah, that's a key consideration. A single IV dose might give you antidepressant effects for, say, up to about 7 days.
Okay.
But the paper emphasizes that repeated infusions, like a series, tend to lead to higher response rates and, crucially, longer-lasting benefits.
So like a course of treatment.
Exactly. For instance, they mention a regimen of 6 infusions over 2 weeks, showing a response rate over 70%, and the benefits lasted on average around 18 days.
Right.
And strategies like maybe 3 infusions a week for 2 weeks, then switching to weekly maintenance, that seems to help increase how long the effects last and prevent relapse.
So it really points towards needing an ongoing tailored plan, not just a one-off.
Definitely. It's not usually a single magic bullet kind of thing.
Okay, so depression is a major focus, but the versatility doesn't stop there. The paper mentions some, well, pretty unexpected uses too, like status epilepticus, severe seizures.
Yes, this is fascinating. Ketamine is emerging as a safe and effective option for managing these really severe, prolonged seizures that aren't responding to the standard treatments.
Wow.
The dosing is quite specific and differs between adults and kids, involving an initial dose, a bolus, and then a continuous maintenance infusion. It's a critical tool in those emergency situations where other drugs have failed.
And what about after surgery? For pain.
Yeah.
We've definitely talked about ketamine and pain relief before.
Right. Low-dose ketamine is used more and more to help manage pain after operations. For example, studies with esketamine after abdominal surgery showed lower pain scores at 4 and 24 hours.
That makes sense.
And a big plus is that it can sometimes help reduce the need for opioids, which, is a huge benefit given the opioid crisis.
Definitely.
But it's not always clear-cut. Its effect on things like postoperative fatigue syndrome seems less certain. And some specific studies, like in kids having spinal surgery, didn't find a big difference in pain or opioid use compared to placebo.
So it's nuanced. Depends on the surgery, the patient.
Fairly context dependent, yeah.
Now, this next one really caught my attention. Cocaine use disorder. I remember we did a whole exploration on this, I think it was TK04, subanesthetic ketamine for cocaine use disorder. The paper mentions higher doses being linked to stronger mystical type effects.
That's a key finding they discuss. These profound subjective experiences, sometimes called mystical type experiences, were actually correlated with a stronger desire reported by the patients to stop using cocaine.
So it's not just biological, there's a psychological angle.
It strongly suggests a potential psychological mechanism, yes. How these intense subjective experiences might facilitate therapeutic change is a really active area of research. It's quite intriguing.
Yeah, how a drug could tap into that.
And importantly, the study mentioned found both the higher and lower doses compared were generally well tolerated in that context without long-term negative issues reported.
Okay, so we've seen this really broad spectrum of uses. Let's shift gears a bit and talk about how it's given, because it's not just the dose, it's the delivery method too, right? The paper lists quite a few ways beyond just IV.
Absolutely. The versatility extends right to how you administer it. So besides intravenous, you've got intramuscular, IM, intranasal, IM, the spray, oral, sublingual under the tongue, subcutaneous, SC, under the skin, even spinal or interosseous, which is into the bone marrow in emergencies.
Wow, that's a lot of options.
And each route affects how quickly the drug gets absorbed, how much reaches the brain, its bioavailability, basically. So it influences the effects.
And for depression specifically, it's not always IV. The paper mentions things like low oral doses, maybe 3 times a week, used alongside other treatment.
Yes, as an adjunct therapy.
Yeah.
And IM injections, subcutaneous injections giving it under the skin, have also shown effectiveness in some studies. We actually looked into subcutaneous ketamine in TK19. Subcutaneous ketamine, remember, there was that case study of long remission.
I do remember that, yeah.
Yeah.
4 years, incredible. What about the nasal spray? Intranasal ketamine.
Right. Ketamine offers a generally rapid onset, and it's obviously less invasive than an IV. So it's useful in more urgent situations, maybe outside a hospital setting sometimes, or for acute suicidal thoughts.
Any downsides?
Well, it can still carry some risk of those transient psychomimetic symptoms, the sort of altered reality perceptions or detachment, though generally the risk is considered lower than with IV administration.
Okay, so lots of ways to deliver it, tailoring it to the situation. Once you've picked a route, how do you actually personalize the dose for someone? Because it's clearly not one size fits all.
Not even close.
Yeah.
Individual factors are huge. Age and weight are basic starting points. Kids and older adults metabolize drugs differently, so doses often need careful adjustment.
Right.
And then organ function is critical. If your liver or kidneys aren't working well, that dramatically affects how ketamine is processed and eliminated. So doses need to be modified there too, to avoid buildup or reduced effect.
Makes sense. What about other health conditions someone might have? Or, importantly, other medications they're taking?
Yeah, comorbidities matter. Like, the review mentions a study with veterans who had both depression and PTSD. The IV ketamine helped their depression symptoms, but didn't significantly impact the PTSD symptoms themselves.
Interesting. So it might target one condition, but not another co-occurring.
Exactly. And other medications, this is a really big one for you, the listener, to be mindful of. The paper specifically highlights benzodiazepines meds often used for anxiety.
Like Valium or Xanax.
Those types, yes. Taking higher doses of benzodiazepines, they mention over 8 milligrams of diazepam equivalent per day, was linked to a significantly lower response rate to ketamine for depression. Their outcomes were worse.
Wow, that's crucial information. So those meds could actually interfere with ketamine working properly for depression.
It appears so, based on that research, and other meds like SSRIs can also potentially alter ketamine's effects. It really drives home how important it is for your doctor to have a full picture of everything you're taking.
Absolutely. And for cancer patients, it sounds like a very specialized approach is needed.
Extremely customized, yeah, because you're dealing with different cancer types, stages, ongoing cancer treatments, other health issues. It's complex. We even touched on ketamine's potential against lung cancer cells itself in TK11, ketamine versus lung cancer, which shows just how broad its interactions can be.
It really underscores that personalized medicine approach.
It's paramount. You have to consider the whole person, their unique biology and clinical situation.
Okay, so we've talked about the promise, the versatility. Now, the really critical part, balancing that with caution. Because it is a powerful substance, the review does talk about toxicity.
Right, it does. Because ketamine acts on so many different sites in the body, toxicity is definitely a risk if the dosage is wrong or through misuse or abuse.
And what does that look like?
Symptoms can range quite a bit, from sedation and confusion to more severe things like hallucinations, agitation, even seizures, stupor, or coma in overdose situations.
So the dose and how it's given really tie into the side effects too. Even the lower doses used for psychiatric conditions, they can still cause those psychomimetic effects we mentioned, like hallucinations or feeling detached.
Correct. Even at therapeutic doses, those effects can occur. And importantly, how it's infused matters. The review points out that giving a bolus, that quick initial dose followed by a continuous infusion, might actually increase the chance of those psychomimetic effects compared to just a slower, continuous infusion from the start.
So maybe starting slow is better.
Often, yes. Slower infusion rates, typically over 40 to 60 minutes without that initial bolus, are generally recommended to try and minimize side effects, especially the more disruptive psychotic-like symptoms. It makes the treatment generally safer and more tolerable.
That makes sense. A slower, steadier approach.
And conversely, higher doses, especially if given too quickly, are linked to a greater risk of not just those psychomimetic effects, but also potentially respiratory depression, which is serious. Even R-ketamine, which is one of the mirror image molecules and generally less potent, can apparently cause more auditory and visual disturbances if given at high doses or too fast.
Are there any specific long-term concerns mentioned?
There are a couple of points raised for consideration. One is about potential neurodevelopmental effects in very young children. The paper notes that prolonged ketamine exposure, defined as over 3 hours in kids aged 3 or younger, might be associated with cognitive deficits later on, possibly due to effects on developing brain cells.
Okay, that's definitely something needing more research and caution in pediatrics.
Absolutely. And then there are rare case reports of liver and biliary tract problems, things like sclerosing cholangitis, which affects bile ducts, and hepatotoxicity, liver damage associated with ketamine use, particularly chronic or high-dose use.
And also a historical concern about using it if there's high pressure inside the brain.
Yes, intracranial hypertension. That was traditionally a contraindication, though practices may be evolving with more understanding. But all this just emphasizes why careful patient screening, monitoring during treatment, and awareness of potential risks are so vital. We touched on monitoring in TK15, ketamine use disorder warning signs.
It really paints a picture of a powerful tool that needs expert handling.
Precisely.
Well, this has been quite an exploration through the many, many phases of ketamine. It's just truly fascinating how one compound can be effective in such different areas: seizures, depression, pain, even addiction.
It really is remarkable. And I think what stands out from this review is just how crucial it is to tailor everything, the dose, the route, the frequency, not just to the condition, but to you, the individual patient.
Yeah, that careful adjustment, that titration seems key to getting the benefits while keeping the risks low.
Exactly. And the science is still evolving. We're constantly learning more about how to optimize these strategies for better, safer, more personalized care.
So, as we keep exploring ketamine's potential, it really makes you wonder, doesn't it? What does this incredible adaptability, this need for such nuanced dosing, tell us about where personalized medicine might be headed overall?
That's a great question. And maybe how might this molecule, which has already kind of upended a lot of traditional thinking about drug development, continue to challenge us and maybe revolutionize how we tackle really complex health problems in the future? It's many lives, as we call them in TK17, ketamine's 9 lives, they're clearly still unfolding.
Lots to think about. Thank you for joining us on this exploration today. Keep asking those questions. Stay curious about all this.
And as always, please remember to consult with your own healthcare professional for any personalized medical advice.
Absolutely. Until next time on Talking Ketamine.